And a warning, this report does contain a distressed baby with burns at the beginning.
Little Jack is the exception now. He's an urgent case with burned feet and hands which the emergency nurses are wrapping in cling film. He's not even 1 year old, but his mother is frantic with worry and finding it difficult to calm him. She had no choice but to bring him in.
To be honest, that wasn't on my mind. It was just getting him where he needed to be.
But he's one of the very few casualties the medics are having to deal with at Warrington Hospital's emergency department. Like many others, they've seen a drastic drop in people turning up, raising fears of a hidden number of casualties, too frightened to come in because of fears over coronavirus.
What I am very concerned about is that patients are staying away, and that I don't believe that the heart attacks have suddenly stopped happening. I don't believe that people aren't having strokes. I'm concerned that people are staying away from coming to hospital because they're concerned about catching COVID or being a burden on the NHS.
The collateral damage of COVID-19 can be seen here too. The only sound in entire hospital buildings normally packed with patients and staff is the clock ticking. This was an orthopaedic surgery unit at Halton General Hospital, now sitting empty. The medics have been redeployed in coronavirus treatment and all elective operations cancelled.
Look at this. Everything has been mothballed. This used to be a theatre. Now it's just a storeroom. It gives you an illustration of just how much has been cancelled and sacrificed because of dealing with COVID-19.
These are the brave ones, those needing essential treatment who are still coming in, vulnerable people with immune systems already compromised. There are worries that a drop-off in cancer screenings and referrals means there are nearly 3,000 fewer people being diagnosed every week, according to cancer charities.
That's good for you, Ernie.
Oh.
That is good.
I must be really relaxed.
It's one of the best you've had.
Ernie Burns is not one to be scared of his cancer treatment, but coronavirus has taken its toll. At 87 years old, he's lived through a world war and multiple epidemics, but COVID-19 is his worst experience yet.
Because of the coronavirus, that my wife isn't allowed to come with me anymore. And while I'm here to do miss her company a little bit. But apart from that, like I say, if you have to be in some sort of hospital, this is a sort of hospital to be in.
What are your worries generally about coronavirus? Because we know that it affects elderly people more.
I know that my wife and I are doing everything that we can to do our share of preventing the spread of it by isolating ourselves. But of course, I miss my grandchildren as well. I haven't been able to hook with them or anything like that for a long, long time, and I miss them terribly. Because they're not that old, they're both teenagers. Because wife and I had been married a little while before we found out what we were doing wrong.
A rare bit of laughter amid the tears caused by coronavirus. Alex Crawford, Sky News, Cheshire.